What if low energy is not just about sleep, age, stress, or needing another supplement? What if one overlooked source of stress in your body is starting in your mouth? A lot of people ask, why am I always tired? But they never think to ask, is my body quietly fighting inflammation somewhere? Most people think of bleeding gums, bad breath, or gum inflammation as dental problems, but the mouth is not separate from the rest of the body. And when there is ongoing inflammation in the mouth, your body may be spending energy responding to it every day, even if you don't feel sick. So today we are going to connect the mouth, inflammation, and cellular energy in a simple way. And the key word here is mitochondria. But before we get into mitochondria, we need to understand one thing most people miss, and that's your mouth is not separate from your energy system. The mouth is not separate from the body. Most people divide health into separate boxes. Teeth are for dentists, and fatigue is for the doctor, and energy is for coffee, vitamins, or supplements. But the body doesn't work in separate departments. Your mouth is connected to your immune system, and your immune system is connected to inflammation. And inflammation can affect how your body feels, heals, and functions. So when someone feels tired, run down, or slow to recover, we should not only ask, what supplement are they missing? We should be asking a better question. Is the body constantly fighting something? And one place many people forget to look is the mouth. This doesn't mean that every case of fatigue comes from gum disease. That would just be too simplistic. But oral inflammation can be one important piece of the bigger root cause picture. So here's what mitochondria have to do with energy. Let's keep this really, really simple. Mitochondria are tiny structures inside your cells that help produce energy. Think of them like little engines or batteries inside the body. They help turn the food you eat and the oxygen you breathe into usable energy. And that energy helps your brain think, your muscles move, your immune system respond, and your tissues heal. But here's the part most people miss. Mitochondria, they don't work in isolation. They respond to the environment inside your body. If that environment is calm, nourished, and low in unnecessary inflammation, your cells are in a better position to produce energy. But if the body is constantly dealing with inflammation, infection, oxidative stress, or tissue damage, your cellular energy system may become strained. And this is why someone can feel tired even when they're trying to do the right things. The body may be spending energy on repair, defense, and inflammation. So the deeper question is not only how do I get more energy? The deeper question is, what is draining my energy in the first place? So now let's bring this back to the mouth. The mouth naturally has bacteria. There's something called an oral microbiome, and that's normal. The problem is not the bacteria itself. The problem is imbalance in those bacteria in that environment. So when harmful bacteria build up around the teeth and gums, the gums can become irritated and inflamed. And you may notice signs like bleeding when you're brushing, swollen or tender gums, persistent bad breath, receding gums, loose teeth, or even slow healing after dental work. Now, many people, they ignore these signs because they don't always hurt. Not all of those symptoms hurt, but pain is not the only signal that something matters, that something's going on. Gum inflammation can be quiet, can be chronic, and easily overlooked. And this is where the mouth-body connection becomes important. When inflammation becomes chronic, the body has to respond again and again. That response takes energy, and your immune system is not free. Healing is not free. Repair is not free. If your body is constantly managing inflammation in the mouth, that may add to the total stress load your body is carrying. And that is where cellular energy becomes part of the conversation. So here's a simple way to think about this. Imagine your body is a house with limited electricity. Your mitochondria are the power generators. Now imagine there are small fires in different rooms of the house. Not huge fires, but small ones that never really fully go away. The system has to keep sending energy and resources to manage those fires. And that is what chronic inflammation can be like. If there is ongoing gum inflammation, your immune system has to stay active. Oxidative stress may increase. Tissue repair may be required. Oxidative stress simply means that extra stress on the cells that the body has to calm down. So the connection is not bleeding gums automatically causes fatigue. That would be too extreme. The smarter way to say it is chronic inflammation in the mouth may add to the body's overall stress burden, and that burden can be part of a bigger picture of low energy, poor healing, and cellular strain. Now, here's what most people get wrong. Here are the 3 big myths. First, many people think if my gums don't hurt, they're perfectly fine. And I'm here to tell you as a dental professional, not always. Gum inflammation does not always cause pain at first. Bleeding, swelling, bad breath, and gum recession can be early signs that something needs attention. Secondly, many people think mitochondrial health is only about supplements. Supplements may help some people, but they are not the foundation. They're not the main issue. So before chasing another capsule, we need to ask ourselves a couple questions. How is our sleep? How is our nutrition? Is there chronic inflammation in my body going on under the surface? And is there any untreated dental or gum issue? Now, third, many people think the mouth has nothing to do with the rest of the body. But the mouth is part of the body. It has blood supply, nerves, bacteria, immune activity, inflammation, and tissue repair. So oral health is not just cosmetic, it can be part of a larger health picture. So what is it that we actually should be paying attention to? So you want to pay attention to certain things like this: bleeding when you brush or floss. If you have persistent bad breath, swollen or tender gums, gum recession, loose teeth, frequent mouth infections, slow healing after dental work, low energy all the time, and feeling run down even after you're fully rested. Now, these signs do not diagnose mitochondrial dysfunction. They don't prove one single cause, but they are clues. And health often improves when we stop ignoring those clues. So the goal is not to scare people. The goal is to understand the system better. So if your gums bleed regularly, don't brush it off. Yes, pun intended. Bleeding gums are common, but common does not mean normal. So get a professional dental or periodontal evaluation if you're having ongoing gum symptoms, bad breath, pain, swelling, loose teeth, or slow healing. Also, you want to support the basic items that are going to help your body repair, things like better sleep, enough protein, less constant sugar exposure, regular movement, hydration, and real food. Real food is a really simple concept. It's something that you can identify without a label, right? You should consider any label a warning label because that's really what it is. And if it comes in a box, a bag, or has a barcode, not real food. All right. And finally, don't self-diagnose. If you have persistent fatigue, unexplained weight changes, uncontrolled blood sugar, ongoing pain, signs of infection, or symptoms that simply do not improve, make sure to speak with a doctor or a dentist if it's in the mouth. Now, this video is for education only and is not a replacement for personal medical or dental advice. So make sure to check in with your medical or dental professional. So here's the main idea. Your mouth may be doing more than helping you chew or speak and smile. It may also be giving you clues about your body's inflammatory load, repairability, and cellular energy stress. Mitochondria are not just a trendy wellness topic. I know there's a ton of information out on the internet right now about mitochondria, and we are learning more about mitochondria every single day. But mitochondria, they are part of how your body produces energy at the cellular level. And if the body is constantly dealing with inflammation, including inflammation in the mouth, that may be one reason the system feels drained. So before chasing another energy hack, getting some sort of energy drink, another supplement, or another quick fix, ask a better question. Where is my body spending energy just trying to fight inflammation? And one of the first places to look is right inside your mouth. And if your gums bleed and your energy feels low, do not treat these as separate problems. And make sure to leave your biggest question below and subscribe for more root cause health conversations that connect the mouth, the body, and long-term energy. I want to thank you for your time. I want to thank you for your attention. Feel free to leave me a comment and hit that subscribe button. Make sure to follow, and I will see you in the next video. Take care.